This is All of It on WNYC. I'm Allison Stewart. May is Mental Health Awareness Month. Our series, Mental Health Mondays, takes a look at the different aspects surrounding mental health. It touches nearly every part of American life, from hospitals and housing to policing and prisons. Yet when policies around mental health care are created, the people most directly impacted are often left out of the conversation. A new book argues that some of the most promising solutions to the country's mental health crises are actually coming from people living with mental illness themselves. It spotlights advocates working to expand peer-to-peer support services, community-based care, and other models designed to help people. It also challenges the idea that mental illness is a character flaw rather than a disease deserving of care, dignity, and understanding. The book is titled Through the Fire: How People with Mental Illness Are Empowering Each Other. Author Frederick Vars is a professor at the University of Alabama School of Law and writes from both professional and personal experience after surviving a psychotic break and navigating the mental health care system himself. Frederick, welcome to All of It.
Thank you so much for having me.
Why did you feel it was important to center the voices of people living with mental illness in this discussion?
Well, I think they provide a really unique perspective and one that's overlooked. When you talk about reforms to the mental health care system, you think of big government, you think of cuts to Medicaid, kind of back and forth in Washington. But what I quickly discovered in doing the research for this book, there are actually many, many more peer-run organizations providing mental health services than there are traditional, hospitals, clinics, and so forth. So really, the people at the front lines are actually those who, with mental illness, who are turning around trying to help one another.
You wrote this book from both a professional background in law and your own personal experience with serious mental illness. How do those two perspectives help shape this book?
Yeah, well, I really started with my own story, and as you mentioned, in my 30s, I had actually two psychotic breaks, leading to hospitalizations and a diagnosis of bipolar. And my experience with suicidality led me to advocacy and an idea called Donna's Law, and allowing people to restrict their own ability to buy firearms. And so through that advocacy, I started coming into contact with other people also engaged in advocacy who had had similar experiences, different policies. And that really is what got me looking at it from that angle.
In the book, you write about how you're going to refer to people and how you're going to refer to mental illness. And I thought it was sort of fascinating. How do you refer to people who have mental health issues?
Yeah, so it's interesting. In the book, I interviewed 50 people, all of whom had some sort of lived experience around mental illness. And I honestly couldn't tell you how many of them had diagnosis X or Y or Z. I didn't ask. And people would tell me mostly about, trauma, childhood experiences, hearing voices, symptoms, right? Because that's what people experience, that's what people live with. Some of them, most of them, I think, were taking medication. I didn't ask those questions either. And so I really let people define themselves, and didn't put a label. Some of them chose to have a label. I certainly identify with a bipolar diagnosis and take medication, and it's extremely helpful for me. But I always, put the person first, and so I never said, obviously, a schizophrenic. I would say a person with schizophrenia, for example. If someone said they had lived experience or identified as a peer, that's how I identify them in the book.
Why was language important?
Well, it's certainly important to me, and I think it's incredibly stigmatizing, and to be dismissed and sort of thought of as a mental patient is something that pretty much everyone, when they get a diagnosis, has to go through. And it sort of strips away your other identities, and you're kind of reduced to, oh, that's what I'm going to be for the rest of my life. And I think you really have to go through the process of rebuilding and sort of putting back together your identity and forming a positive identity And that's really, an important part of what peers do. A lot of that work they're doing is, helping themselves get through self-stigma, and being able to tell their own story and use it to help others, can be extremely powerful kind of self-therapy.
A new book explores how people living with mental illness are leading efforts to reform mental health care in America. Frederick Vars, professor at the University of Alabama School of Law, joins us to discuss his book, Through the Fire: How People with Mental Illness Are Empowering Each Other. Obviously, people living with mental illness, it's different every time, but let's take an example. If someone sees somebody they think's in crisis and they call 911, what can happen?
Yeah, so this I also lived through myself. My first psychotic episode, my wife called 911, and this is before there was a 988 number. But the situation would have been the same. In my, because she was asking for transportation to the hospital. I refused to go. And in that situation, in most places in the country, even today, the first responder will be a police officer with a gun in a uniform. And that I think is a huge mistake. We're actually seeing reform take place in parts of the country, where peer-led crisis response teams are going to actually interact with patients. And a big difference, I'll tell one story about crisis response, with a peer response team in San Francisco. A woman I spoke to was the leader of the team. They were in their van and just happened to be driving by where a man they recognized, a homeless individual, was in the, clearly having an episode where he was seeing things other people were not seeing, reacting to stimuli. He was waving a knife around, and it was in sort of, an unexpected part of town and one of the nice neighborhoods, tourist, on top of the hills, clearly in crisis. So they drove their van over. He immediately recognized them, trusted them, threw down the knife, came over and started venting about his various problems. And they asked him, well, what do you need? What can we do for you? And can we give you a snack? And so, yeah, and they gave him some food and he sat down and he started talking, more rationally. And then just a few seconds later, police come blaring and, two cars, lights flashing, cops jump out. Where's the knife? Where's the knife? And at this point, the guy is so calm and really relaxed. He wants to help the police officers. So he's like, "Oh, I'll go pick up the knife and hand it to them." And the woman on the response team was like, "No, I don't think that's a good
Yeah.
idea." So she kind of kicks the knife under the car and says, "You just stay here. Let the police officers take care of that." But basically, it just indicates, what the kind of fundamental difference in mentality when peers, interact with other peers. The question is always, what do you need? What can we do for you? What do you want? And it might just be a sandwich, right? Police show up, they want compliance, they want, you to immediately follow orders, and those interactions can so often turn deadly. And it's the individual in crisis is the one who's going to get hurt. It's not going to be the police officers.
In the third chapter of the book, you write, many of the old state psychiatric hospitals have been replaced by jails and prisons, and that the rate of mental illness in prison is roughly double, 41%, than the rate in the general population. How often are jails and prisons functioning as de facto mental health institutions?
Yeah. Yeah. I mean, basically, it's a lack of good community care options. We just don't have the kind of treatment in the community that people deserve. And, the old model, and the model that the current administration is actually trying to push us back to is kind of mass institutionalization. People were just sort of locked up, forgotten about, and put away. We have so many better options, so many better treatments. We have models, for example, assertive community treatment. So even people who, with treatment-resistant schizophrenia, for example, like one of the most difficult diagnoses to handle, would not be able to live independently in the community, are still able to live in apartments because they have a team, an interdisciplinary team come sometimes daily at first, hopefully weekly, maybe monthly at some point, administer medication, bring food, make sure their time, they've got needs met. And, that sort of intervention, that kind of intensive intervention can keep them in an apartment, maybe across the hall from somebody else who's also going through a similar situation. And the ACT team here in Birmingham that I talked to does have a peer on the team. And that individual has made really surprising and terrific connections with some of the clients in the team member. They're not just sitting around in their apartment, hearing voices all day. Peer sits in the room and they watch TV together. And in one situation, the client actually mentioned, "Oh, I'm a veteran, and they've never taken care of me." And the peer said, "Well, you might be entitled to some benefits." And so they kind of looked into the process, and they actually found that he was due almost $100,000 in unpaid benefits from the VA, which had the peer not been taking the time, sitting in the room, interacting with the individual, never would have happened. Another situation with the peer, discovered one of the clients liked to play a musical instrument. So they get together, and the peer also plays a musical instrument. So they jam together. Something that just, wouldn't happen, obviously, in an institution. But, it's those kind of human connections that are possible when peers are part of the mix and people are not just locked up and thrown away. Again, you wouldn't see that in a jail or prison.
Yeah, Frederick, hearing you talk, it sounds like peer led mental health reduces isolation.
Absolutely. It does. I mean, and in some ways, with that ACT program too, I mentioned, you may be across the hall from somebody else who also has schizophrenia. You are intentionally across the hall from somebody with schizophrenia. They always try to put two or three people in a building, so there is a bit of a community. There was another housing situation in Massachusetts. I spoke to the peer who spends much of his time in there. It was supposed to be transitional housing, but the people didn't want to leave. They had found a community. They had meetings every week. They have a sort of democratic, okay, we're going to have a picnic. Who's bringing this? What do we want for food, and the budget? And so they had built this kind of little community, and they never wanted to move out. So it just turned into a kind of permanent supportive housing. The peer came in, spent a lot of time talking to people, helping them, if they were unable to pay rent, and so forth.
We're talking about the book called Through the Fire: How People with Mental Illness Are Empowering Each Other. It's by Frederick Vars. You mentioned the gentleman who had VA benefits coming to him. Hundreds of therapists and social workers have left the VA after the Trump administration announced plans to overhaul the VA. What policy changes has Trump made so far, and how do they affect what you're talking about?
Yeah, I would say back to the housing issue where I mentioned, the current administration going to institutionalization. So it was an executive order he issued, I think it was over the summer, but pretty early on over last summer, basically saying for homelessness, we need to move back to institutions. So part of that would have to be expanding the criteria for civil commitment beyond the current standard and the one that's been approved as constitutional, is that you are both mentally ill and a pretty imminent danger to self or others. So basically, the idea would be to say people who really aren't able to take care of themselves, so as to include a lot of homeless people, would also qualify for institutionalization. So that is the kind of Trump approach to housing. In the same order, he said housing first has been a failure. The Housing First program, and I don't know if listeners are how familiar they are with that, but it's actually been in places where it's been implemented well. It's been a resounding success. 80 to 90% of people who are housed through the Housing First program remain housed kind of long term. And basically, the difference between housing first and other programs are usually called like treatment first.
Mm.
Um, Treatment first means you got to get sober, you've got to agree to a particular regime of mental health treatment if that's appropriate, and so forth. And then we'll give you housing as a condition of you meeting these prerequisites. Housing first says, no, first get you a place to stay
Mm.
and then get you services, provide you with, reasonable access to services, right? Get you transportation to the clinic, get you, people coming into your unit if you need that kind of level of services. But you don't make it conditional because the people who need the help most are the ones who are going to get it, who are going to be least likely to get it if, the ones who are unable to get over that addiction, right? Or to, suddenly get on a stable course of antipsychotics or something before they actually get housing.
As we wrap up, I did want to ask about family. Before peers comes family. How can
Yeah.
families build trust with a loved one who may resist treatment?
That's a really tough question. And I was personally incredibly lucky to have been married for years before my first manic episode. So there's never a question of trust. I think it's really important for family to not to minimize the experience, not to argue with a person. Who may be, experiencing the world in this way. You can't just tell them, oh, you're thinking irrationally. Oh, you should do what the doctor says. You have to take their concerns as real concerns because they are. And ultimately, an individual, if they don't buy in, they're not going to succeed. And your role as a family member is not to be the treatment provider, it's to provide support to the individual.
What's the most urgent change in policy that you would make right now if you could? You have 1 minute.
Wow. Um, I think the crisis response, getting more peer led teams out there is really important because it connects directly to the jail and prison statistic that you mentioned.
Yes.
Because think about what happens, in an interaction with law enforcement. If law enforcement encounters resistance, sometimes it will lead to a tragedy on the scene, a shooting, but often it'll lead to jail, right? That
Yeah.
the individual resists arrest, or and somehow the situation gets out of control, and that starts a person into the criminal process, which is the worst possible place for a person with mental illness. A
Yeah.
peer-led team is not only going to avoid the tragedies, but is also going to direct an individual to what community resources are available.
The book is called Through the Fire: How People with Mental Illness Are Empowering Each Other. It's by Frederick Vars. Thank you for taking the time to explain this to us.
Thank you. My pleasure.
And that's all of it for this hour. On the way, we'll discuss the 2026 Men's World Cup.